Médecins Sans Frontières sees its core role and core responsibility responding to the consequences of conflict and how that affects the health of the civilian population and anyone else who is injured or falls sick. Clearly that's a very difficult thing to do, as a conflict setting is insecure, it's violent, it's unstable. And so we try and identify around the periphery of an area that's directly affected by conflict and securing access, in other words, agreement from all parties to that conflict, the terms and conditions under which we can hope to work in a way that enables safe and unhindered access to the population that's affected by the conflict, and safe conditions for our medical staff to be able to set up the necessary clinic, field hospital, etc., and provide for that frontline emergency care. And unfortunately, in many conflict settings, it's simply too insecure. There's too great a risk. In the case of Syria right now, it's very, very hard to be directly at the front line of the conflict. The front line moves not on a daily basis, but an hourly basis. And the risks you're exposing a team to are just far too great. And so there you need to set up your infrastructure somewhere around the periphery of the conflict, outside of the conflict, where people can have access and you can hope to maintain the minimum security you require to give them safe and unhindered access and to provide the safety and security and the infrastructure that your own team needs. Managing healthcare in conflict settings starts there, let's say, with the frontline direct impact of that violence. Then there's a secondary phase, there's another concentric circle outside that direct, immediate frontline emergency care. And that's dealing with what the impact of the conflict has over the longer term. And so over time you start to see a much greater impact from a conflict in a conflict setting than simply the emergency frontline needs of a population. You start to see the impact that having food insecurity, having displacement, poor shelter, poor living conditions starts to have on a population. And you start to see that in terms of outbreaks of infectious disease. One of the other phenomena that you clearly see in these kinds of settings is that this rampant insecurity affects people in very many different ways. One, it certainly affects children. They become very traumatized. Abuse of women can take place either as part of the conflict or simply directly linked to the environment of insecurity around the conflict. The whole population will suffer to a large degree from mental trauma. That not only has an impact on them as an individual, but it also impacts the way they behave within their community and within their own family. We really need to have a comprehensive health approach to address not just the frontline emergency medical needs of a population directly affected by the impact of a conflict, but over time we need to build a much more comprehensive approach to the secondary healthcare needs that start to evolve from all the decline and neglect and the rapid decrease in basic living conditions of a population in an area where simply the infrastructure is torn apart.